The following was recorded in front of a live studio audience at the Studio 21 Podcast Cafe. This is the United Podcast Network.
This is Africa Diaspora Connect.
Join us as we take the journey from the motherland to America.
We share our experiences and learn from them.
Here is our host, Kibathi Gaturu.
What's up? What's up? What's up, man? I haven't seen you all year, Ben.
I know, it's been way too long. It's been way too long, Kibathi.
It's been since what, 2020, the year that was, man. Good to see you, brother.
It's very good to see you.
All right, man. So listen, man, I got this. This is gonna be the show, man. So we have these vaccinators coming in after thing here, but man, so you know what happened to me?
I've heard rumors.
Damn, man, she got me.
She got you?
She got me.
How dare her? She
got me, man. COVID, man. I can't stand her, man. Let me tell you something, folks. That was something else. So you know how this is how it all pans out, right? I won't disclose the location, right? So me and a couple of buddies of mine, we're just getting together. Everyone's wearing a mask initially. That's how it works, right? You get to the location, masks out. That's how it works. We all know that. And we commingle, libations, a couple of smokes, high fives, we hug. We go home, right? We go home. All right. And then that was Saturday night. All right. Then Sunday comes in. It's Monday. It's Tuesday. Life goes on, right?
Yeah.
Wednesday, wake up in the morning. One of my boys sends me a text at 3 in the morning. All right.
That's not normal, right?
All right. So we're like 8 of us.
Yeah.
Hey guys, I feel like shit. Since Sunday, my body is breaking down. I'm like, I think I got the COVID.
Oh man.
But so you're like, okay. So I respond. I'm like, okay, get better. Hope you feel better. Keep me in the loop. Get tested. 2 hours later, another guy. I feel like crap.
Oh no.
An hour later, another guy. I think I have it. Okay. Your mind starts playing games on you right now, right there and right then. Okay, okay. All right. So I'm like, I do 2 push-ups. I think I'm fine. I can't get me, man. I'm Superman, right? So everyone starts to test. So tests, negative, group of guys. Taste or smell, I can't smell, I can't taste. All right, I can't do that. All right, I'm lethargic. All right, something's not right here. Get my test on Saturday. Tuesday, you know what they do to you? They send it to you in bold red. You're positive. In red, it's capital letters. You're positive. It's so huge. Man, it's a trip. I tell you what, man. Guys, COVID is real. This thing is out there, folks. You think 2020 was hard? Guys, listen, 2021 is going to be much harder. Pay attention. COVID is out there. Hey, team. Hi, Beth. How's it going, Mercy?
Good, Kibathi. Nice to be here with you.
Oh, you are a godsend. Thank you so much. This is a timely topic. So good to have you both. I'm going to start with a little intro, go over your bio that you sent to me earlier. Born and raised in that beautiful Kenyan country of ours, 17 years of experience in community health fields. Currently employed at Lowell Community Healthcare as the Director of Community Health Programs. And in your role, you promote health services for patients, supports professional development for staff and other care specialties in the community. You stimulate community engagement and actively, I see you participate in health and community improvement initiatives and facilitating as well in cultural competencies, medical interpretations, all the whole nine. I see it right there, Mercy. You advocate, you're a mentor, you're go-to person for many, and we know that in the community. And you also have your MBA from Fitchburg University, trainings from everywhere. You're our go-to person. I feel vindicated. I feel vaccinated already. Welcome, Mercy.
Thank you, Kibathi.
All right, and you're proud Lowellian since 2003. Congratulations. Congratulations, the
you.
city of Lowell. Thank you so much. We're going to shift gears here and let's see Beth now. Now, Beth Hale, she's an RN, MSN, CENP. She'll tell us what that is. She's a creative and innovative nursing leader that brings extensive experience from and in diverse care settings. Worked in New York at St. Peter's Hospital in Albany, also St. Joseph's in Nashua, Catholic Medical Center in Manchester, Elliot Hospital in Manchester, New Hampshire. Excellent. So currently at Lowell Community Healthcare since 2015, you serve as a Chief of Clinical Services and Incident Commander for the COVID-19 pandemic response. That's what I'm talking about. She's certified in executive nursing practice and holds a doctorate of nursing practice from the University of New Hampshire. Amazing. Surgical oncology, admin operations and nursing practice, regulatory readiness, clinical nurse leadership, disease management, implementation of electronic health. My goodness. You're currently appointed as the VP of Patient Care Services, also on the board of directors for the American Organization of Nursing Executives. Oh my goodness. All the credentials in the world to see. Thank you so much. Welcome to Studio 21, the home of the African Diaspora Connect. I'm your host, Kibathi, as I just said earlier. So where do we start? Where do we start? Man, this pandemic has taken the world by storm. I was talking about my situation, Mercy and Beth. I'm one of the statistics. I'm one of the statistics, and I'll tell you this. I thought 2020 was the worst year ever. And, I came into 2021 believing that, honestly, COVID is past us. But, folks, it's within us. It's here, and it's here for quite a while. So you guys are the experts. All right, I'll let you guys go and tell us what vaccines are currently available. I hear Pfizer, I hear Moderna, I hear people saying, oh, I'm not going Moderna. I'm not. Tell us, who's going first? Tell us. Mercy, how'd you like to handle this? Go ahead.
All right. So thank you so much, Kibathi, for that wonderful introduction, and thank you for having us here with the African Diaspora Connects. I've been looking forward to this day for a long time.
There we go. So
I will introduce, first of all, to say that we are coming from Lowell Community Health Center, and the health center is one of many in the state of Massachusetts. There is a total of at least 52 community health centers in Massachusetts, over 1,300 health centers throughout the United States of America. Now, health centers are federally qualified health entities. We do not discriminate. We do not choose who to see. We see everybody regardless of their immigration status, regardless of if they can pay or cannot pay.
Good to know.
So we encourage everybody who doesn't have primary care to look up a community health center near them. The health center is open. It's good to know that even if the COVID-19 hit in March, community health centers are still serving people. So if you don't have a doctor, check us out. We do dental services. We do eye care centers. We have a pharmacy on site. We have labs. We have the entire primary care, behavioral health, pediatrics, HIV services. So everything you can think about that somebody needs, the health center is open 24/7.
The whole kit and caboodle, correct. Got it.
Yes, we actually open via mainly telemedicine right now. About 75% of our patients are being seen the way we are seeing you right now. So nobody should be worried about calling us at 937-9700 or checking us out at lchealth.org. We are here to serve you in the building and outside the building, mainly at this time. And we also help you apply for insurance if you don't have health insurance for Mass Health. That is something that people always worry about. So if you want to find out more, you can always reach us out and we can help you out with signing up for insurance. Lastly, I want to say, make sure you get your flu shot. Don't forget to get your flu shot. Everything else, you might have to wait maybe for your vaccine. Beth will tell us more about that. But your flu shot is available right around the corner, maybe at a pharmacy near you or at the primary care doctors at the health center. We are giving flu shots. So check us out. So with that, maybe Beth can just jump into the COVID-19 vaccine, because that's what brought us here today.
That's why we're here.
I give us information about the health center.
Appreciate that. Appreciate it. Beth, it's you and I now. Thank you so much, Mercy. We appreciate you.
You're welcome.
So Beth.
It's us. Yeah.
We need help.
I know.
We need help.
We do.
All right.
But we're here to help. And we're getting there.
And we're scared. We're totally scared. All right.
Yeah.
And justifiably so. All right.
Yeah.
So let's start with these different vaccines right now. So I'm not in healthcare, but I got a lot of friends of mine who are nurses, and some of them will swear to, I'm not doing the Moderna thing. I'm doing Pfizer. I'm doing Pfizer. What's the difference? Why are people? What's the ruckus about? Where are you going with your vaccination?
Yeah, they're both the only vaccines right now on the market. They are under an emergency use authorization, meaning we've authorized these two. We haven't. There was no corners cut in the research about the mRNA vaccines. In fact, we've been studying mRNA vaccines for 30 years. Mm-hmm. So
what
we have a lot of experience.
What did you call them? Emma, what vaccines? What did you call them?
They're called mRNA.
Okay, what does that stand for? Anything?
Messenger RNA. Okay, so it's actually something that sends a message into your DNA.
All right, okay. mRNA, got it. Okay.
Yeah. So what it does is when it enters your cell, it tells that cell, this is something good, let it go in, or not good, don't let it go in.
Okay.
So it's pretty neat when you get to the cellular level of our body. And of course, I'm not a scientist, so I can't get into all that. But, the thing about the mRNA vaccines, they go through the same rigor that any other vaccine does in development. They go through the very significant scientific rigor. And personally, I've taken the Moderna vaccine. I got my second vaccine yesterday. Mercy has also received the Moderna vaccine, and I actually administered her second vaccine today.
I saw that. She was wincing. She was wincing. I saw that. Yeah. Did it hurt?
So they are highly safe. We're here to say they are. 28 days ago, we received our first vaccine, and between yesterday and today, we both received our second. And other than, some arm pain, which is very typical with most vaccines. I mean, those of you who get the flu vaccine, we always say, oh, my arm hurts, and you forget why. And then you realize, oh, I had my flu vaccine. It goes away before you know it. So they're very safe. They're very effective. And I would tell you personally, I would much prefer a little bit of arm pain and maybe a little bit of fatigue over the COVID.
Okay.
The COVID virus, we've learned a lot over the past almost year now, but we still have a lot to learn. And what we do know is it certainly affects, I would say it affects different individuals and different cultures and different ethnicities very differently. And we do know that it affects those of African and those of Hispanic origin much greater. There's much disproportionate effects, both from morbidity, meaning how sick you get, and also from mortality, meaning there's a higher death rate.
And why is that? Why is that scientifically? Why is that?
Well, it's usually not scientific. It really has to do with your ability. So the types of social settings that you live or work in, you may be more risk to get it. So typically, you're out working in grocery stores, for example, and in public transportation.
Understood.
So you have a greater risk of contracting it.
Okay,
and then I also, additionally, those populations may not seek healthcare. And I think what Mercy said when we started was, we're here for everyone. It doesn't matter.
Yeah, she said that.
So, we want to take care of everyone. We want to make sure you feel comfortable and feel safe. And we're going to do whatever we can to make you feel that way and feel trust in the healthcare system and trust in what we do in these vaccines. And that's why we're here to say we both received them. We're doing well. And it's the only way we're going to end this pandemic. It's the only way we've ever ended pandemics. Polio, we've put polio to an end through mass vaccination.
So I hear you got 2 vaccinations. I mean, how many vaccinations are we getting? You already have 2. How many more are you getting?
Yeah, so right now, under development, there's a few more manufacturers that are developing very quickly. Probably Johnson & Johnson will be coming to market likely in the next couple of weeks with a third vaccine candidate. And there's an Oxford vaccine candidate that also is currently under research and study that could come to the market also within this year. And then there's many more, but those 2 are kind of the 2 next front runners. So at this point, there's 2. There's Moderna and Pfizer, but there are very quickly going to be a few more. And each one of them has different storage recommendations and ease of use. Johnson & Johnson, for example, is a 1-shot vaccine, where the COVID vaccine, the Moderna and the Pfizer, are a 2-shot vaccine. Mm-hmm. So logistically, the Johnson & Johnson vaccine will be a little easier for those of us in healthcare to administer. But they're all highly effective. In fact, Moderna and Pfizer's vaccines, after your second dose, you have 95% of protection. from the COVID virus, which is that is very high.
For a layman like myself, all right, who's not in healthcare, so I tend to gravitate on all the negativity. Give me the worst case scenario. What's the worst case scenario that's coming out of this vaccinations?
Out of the vaccine? Yeah, the worst case scenario is, it doesn't work. So we do know that 5% of individuals who get it, it doesn't work to the same level that it works for 95% of the population. So you're going to get a little protection, but you may not get the 95% protection.
Side effects, negative side effects.
Negative side effects, arm pain. I'll guarantee you when you get the vaccine, you're going to have arm pain. From mild to, annoying. Like this morning, I was thinking, good thing I'm not lifting weights today. I'll take a day off of weightlifting. To a lesser extent, people do experience generalized aches and pains, feeling tired. Some people had some chills. Very, very lesser extent, nausea, maybe a little nausea. And then some individuals do experience fever. A lot of the side effects do come after the second dose. And the reason you're having side effects is because your body's immune system is doing what it's supposed to do. It is developing that immunity that you need to protect yourself against getting the COVID virus.
A friend of mine who's a doctor back in Nairobi actually sent me this amazing thing on my LinkedIn here. He tells me here that the most important vaccine remains our inoculation against fear. Anxiety, panic is our greatest enemy. It clouds judgment and brings about a mental lockdown. Dr. Charles Kamatho, what do you think about that? The mental game?
I agree with him completely. And you can, I would say, and what's different with the COVID virus that we've not experienced in any other major virus epidemics or pandemics in our country, in the world, is that we have social media now. And social media is like a feeding frenzy. And as you know, one person posts one thing, they paste it, they put it on their Facebook page, and it reaches millions and millions of people. So what's happening is it's a feeding frenzy, and it's fueling this hysteria and fueling all this misinformation. So that's why Mercy and I are here to tell you what are the facts as we know them as healthcare providers, and really go to trusted sources, go to sources that you trust. And all of us have to shut down the internet and some of that hysteria that we read. I mean, I certainly read it as well. And I just always go to the facts. I always go to the sanyence.
Understood.
You can't argue science.
I understood. China has suspended use of Pfizer, and Norway reports 23 deaths in elderly people. All that crap. What's any all these? That's what resonates.
I haven't looked at all of the data on that, the Norway information where there has been some deaths. I would say when you look at that age of that population, those individuals that received that vaccine were quite elderly, and they likely had many other medical conditions that likely contributed to their death. They have to study more to determine what exactly happened, but it's highly unlikely that the vaccine is what caused their demise. It's likely that they had something else. It was, just their time, and they happened to subsequently get the vaccine.
The bottom line is, let's stay positive and understand that we need this vaccination. That's the bottom line. That's what I'm hearing from you.
We need this vaccination.
We need that. So let me ask you this. What is a new COVID strain? What does that mean? What's that all about?
Yeah, every virus, viruses are really smart. That's why it's really hard for us to fight them. They're very smart. They have a thick protein layer outside of the cell that's kind of impenetrable. And, so we need to figure out through our mitigation efforts with vaccines, how do we teach our body to be able to fight that off and not allow that to get in.
I think you're breaking up a little bit.
So just like bacteria, they become smart over time, and then they kind of create, they create a new variant. They might have an extra spike on them. They might develop an extra layer of protein around them. All viruses do that. We knew coronavirus would do that. At this point, the variants that have been identified are completely, the vaccine is completely effective for them. It just means that there's more variants out there. And when there's more variants of the virus out there, it means that there's more likelihood that it can spread easily and more people can get it. More the reason now than ever that we have to get these vaccines distributed to individuals to protect people from this terrible virus.
And going back, and I'm actually going to go back to the disease itself. You talked about how your body handles the vaccination differently. Even the disease, I started off my segment today by talking about I got afflicted at the beginning of the year, and my symptoms were very mild, extremely mild. Mm-hmm. I have people on the flip side who can get out of bed. Does your body just find a way to fend for itself, or is it just a different strain? I mean, how do you account for the different variations in these symptoms?
Yeah, I mean, it's a great question, and we don't know everything about it. Yeah. And that's what makes it really hard. If we knew everything about it and we knew that it affected Mercy this way and Beth this way, then we could really target therapies, but we don't know. It doesn't discriminate. Uh-huh. We can't account for why someone who's 30 has gotten COVID and died and why someone 80 has gotten COVID and done okay. We do know that people are much higher risk for death from COVID who have other pre-existing conditions such as diabetes or hypertension or obesity. Mm-hmm. But that's not always the case either, because there's been healthy individuals who have contracted the COVID virus who also have died from it. So we don't know enough about it yet. Let's just remind ourselves, the first documented case of this virus was a year ago yesterday, I believe. Okay. So it's not even been out there long enough for us to study it. So we have a lot to learn. But it's great that you had it and that your symptoms were mild, but that's not always the case.
Understood. Now, does your body now develop an immunity now? Are you any better after you survive an attack?
What we do know is you develop an immunity for a short period of time, but we do recommend that individuals who have had the virus, as long as they're symptom-free and they're a few months out from having the virus, that they still receive the vaccine, because we do know that natural immunity with the COVID virus does dwindle over time. Okay. It's not the same immunity as you would get with the vaccine.
Understood. So another question.
So you would still need to think about getting your vaccine when you do become eligible for it.
Absolutely. I'll let my healthcare brothers go first, and I want to see if they lose their hair. I'm not going for a while, but we'll see what happens. Another question they asked me was, so when you're traveling, right? So I get the vaccination. Okay, and I understand you get a card. So when I'm traveling, do I still have to get a COVID test when I'm on a plane? Do I still have to go through all that? Do you know?
Yeah, good question. And I would say that things are evolving so quickly. It's hard to answer that question today. It could change tomorrow. Because we've just started vaccinating over the past month and a half. I don't think our country has figured out yet. What does that mean? What are the restrictions still going to be? We do know that because we're so early in the vaccine program, that we still want to continue our, wearing of masks and social distancing. Got it. Just until we get enough immunity out there and enough individuals protected. So if you were flying, it's probably up to the, whatever state you're in or whatever country you're going in, whether or not they're going to test you or not. And I think over time, as more people get vaccinated, we'll get more guidance from the government as far as, does it make a difference if you've had the vaccine or not, as far as if you get the test or not.
It's mid-January. When is it going to be mainstream? How many months? How far out are we before us, general public, will be able to see the vaccination out there?
Yeah. I mean, I would say, with the new administration at the federal level, we're very hopeful. Yep. President Biden has already created an infrastructure and set up some executive orders and some teams to really begin a heavy focus on eradicating this virus. Mm-hmm. So I would say I'm very hopeful that we're going to see over the next few days and few weeks a lot of activity, a lot of infrastructure that's going to be set up at the federal and state level to help with more mass vaccinations and more production. He did sign the Emergency Defense Production Act, which means that that allows us to produce a lot more vaccine in a very quick order. Mm-hmm. So very quickly, I would expect that we'll be vaccinating the general public, March, April timeframe.
Got it. And as we're winding down here, how young do you need to be? Children, how young? What's the youngest eligibility to get a vaccination?
Yeah, very good question. So both of the vaccines currently available, the Moderna and the Pfizer, Moderna was studied on individuals 18 years and older, and Pfizer 16 years and older. So no one under the age of 16 at this point can get either one of those vaccines because we just don't have enough information. We're actively recruiting children into clinical trials now, and they're actively doing clinical trials. So I would expect sometime this summer we will have more information about the safety of the vaccines with those age groups under 16 and under 18.
This is absolutely awesome information. Hey, we want to thank you guys, all you first responders, everyone out there. We want to thank each and every one of you for what you're doing. Your establishment, Beth, I want to thank you guys. It's Lowell Healthcare. What is it? What's your name again? Lowell
Community Health Center.
Lowell Community Health Center. Thank you for all the strides and everything you're doing. We need this vaccination. Like I said, you know what? I was scared and justifiably so. I'm in my 50s and it's not because it's middle age. It's just that it's just, you don't get sick. You never get sick. And all of a sudden it's like, listen, I got this dreadful thing. And I know friends of mine who've been intubated, who've been in ventilators for weeks on end. We've lost people that we know about within our community right here in Massachusetts, fellow countrymen. So it's up close and it's absolutely personal. So guys, let's pay attention. Africa Diaspora Connect coming at you from Studio 21. Thank you so much for all your information, Beth. Keep doing what you're doing. Mercy, I owe you one. Asante sana. We'll be in touch. We will be in touch. Asante sana, Dayangu.
Yeah, thank you. Karibu sana.
Asante. So folks, you heard it here. Once again, this is 2021. This thing is real. If the bondsman is going to get this thing, no one is safe. So you guys take care. Social distancing, I'm telling you right about now. Yeah, it's real. Thank you so much. Wear that mask. Subscribe to this thing, guys. We're on our quest to 1,000. You know what to do. That quest to 1,000. Like this one. Let me hear those comments. Not just 4. We need 40 comments. Vaccination, the COVID number 19. Coming to an airwave near you. Stay vaccinated. Bondsman saying, Kwaheri. Thank you so much. All right.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Cafe, the United Podcast Network, its partners, or affiliates.